the app, as soon as get into the clinic, by using this IP, the check-in will happen. As soon as he get into this clinic, the doctor came to know that the patient has come. So the communication is already started. So this, we are building that right now.
Exactly. It increases the patient
Yeah.
experience
And
in
the
the.
PRO that the we are cutting the PRO in between, whereby as soon as come the greeting, everything will happen automatically. You have reached, and what is your expected time to get into that things. If suppose he reached early, so what type of content has to be given to him, but continuous engagement, because the medical things, we can give so many, what is his past history, what is the new, everything we are giving as a content continuously.
Yeah, agreed.
This
And
is a new thing in a way.
yeah, I also would like to add to this that Wi-Fi has also enhanced patient experience, like not in Dr. Batra's, but in larger hospitals where there are health checkup done, patients have to travel from one floor to other, one department to other. So they are given a RFID tag which is connected through a Wi-Fi, and they are guided like you have to go here, go there, and the TAT of each is calculated. So this is also one new transformation which has enhanced the industry.
In fact, just on a lighter note, the point which I would like to make is whenever a patient walks up to a hospital, he's usually very tense and anxious. Give him a free Wi-Fi and he's on his mobile. He will forget about all the anxiety that is flowing around him. And at least that experience management itself is a very big boon for the patient in that sense.
Yeah, see, but now technology has its own challenges. Whenever you give Wi-Fi to a patient or the patient relatives, there is a aspect of security also. Because if you have given him a Wi-Fi, he may come in your network, he may hack your network, he may have access to the patient records, etc. So I think Mr. Yen would be throwing some light on it, like how does he manage with his solution?
Sure, thank you. It's interesting and somewhat mystifying that I'm even on this panel, but we do have some experience in the in the hospital area, and obviously data privacy is key. Most of the systems that we've been asked to implement have involved the sort of things that Suresh was talking about. So, a big issue in hospital is queue management, for example. So I think we've all had the experience of turning up to a hospital, either for ourselves or for one of our family, where you have a 2 o'clock appointment, but actually the doctor, I don't know what he's up to, hopefully he's looking after other patients, but he doesn't turn up until 3:30. So one of the key things we've been asked to do is to implement systems which will notify patients, of when the doctor is available, and then they can sort of go away and come back. Now, obviously, that involves a level of registration. The other key part is, someone coming into an area, the Wi-Fi recognizing that device and automatically sending information to them. Now, all of these applications have very serious privacy concerns. The number one thing we're always asked to do when we implement a medical or a hospital Wi-Fi network is to segregate all of the traffic off, the guest traffic off from the main hospital traffic. And obviously that's not just due to privacy. There are mission critical life and death situations that depend on certain parts of the network. So segregating off that traffic is both about privacy and protecting the integrity of the other parts of the network. Generally speaking, that sort of segregation continues. So we don't have patient records being mixed up with medical records, being mixed up with records in relation to a simple hospital visit. I guess the other aspect of it is that we're talking about multiple different types of visitors, right? Most people in hospital are actually visitors. You've got some full-time staff. I'm not sure what the situation is here in India, but certainly where I'm from, you've got your patients, obviously, which are a huge population, all with their own devices or with their own particular needs. You've also got your visitors, who obviously have needs within a certain time period. could argue that they should just be talking to their loved ones, but sometimes they may want to check the weather. And the other one is the specialist doctors, right, who don't necessarily work in a hospital or in a particular hospital, but they move around from one place to another. So keeping those different needs separate from a data point of view, from a privacy point of view, is always very key to what we do.
Thank you. One more aspect this Wi-Fi has really helped patients is digitization in terms of patient records. Now, practically all the hospitals do a digitization of the records, and the most painful part for the patients is to carry the baggage of the records every time they visit a hospital. So having the records digitized and having an app which can be accessed over the Wi-Fi is the in thing now. If Girish, you can throw some light on this.
So rightly said by Girish, there are, if I look at it in terms of the landscape that has been opened up by Wi-Fi, it is about accessing the medical patient records with ease. It is about doing the rounds in the hospital wards with just a tablet device in your hand, and probably even giving a prescription online, which is an email getting shot out or an SMS getting shot out to the patient. These kinds of automations are getting into picture and possibly becoming relevant today only because of the kind of ease and simplicity with which now you can deploy apps, build apps, okay, and provide these kinds of services in a fairly simple manner. As Girish was pointing out in the beginning, today there is not a single piece of cable that is being lugged around everywhere. Just imagine what used to be those days when we used to talk about network cable cuts, network getting disconnected,
Yeah,
and all those
this
scenarios.
is a very big boon to the rural areas, where there is no infrastructure.
Exactly. I was coming to this point in the sense, I'm sure many people would have heard now, the Indian Railways, for example, has Wi-Fi enabled many of our key stations. Now it's actually, customer is not somebody who's now walked into the hospital or to the healthcare unit. Customer is floating around everywhere for you. It only now totally depends upon you, how exactly are you able to reach out to the customer. So if you can somewhere tempt your customer to download the app, then he's yours. Because on anybody's network, you're actually in a position to now reach out to him. Probably even, so if I look at from the social angle point of view, be in continuous touch with him, have something like a hotline. We have various hotline kind of scenario coming in. So somebody is a cardiac patient. If I can have an app where there is a hotline button, where something goes wrong with me, and I just press the button because I really don't have that much amount of time to probably type out a message. If there's just a button on my app which I can click, message goes to the hospital or to the unit, and the unit knows now where I am. That those kinds of locations then become very easy for me to be able to reach out to the customer, give him timely care. There are scenarios which somebody never imagined, which becomes imaginable today only because of the way with which we can connect simply on the Wi-Fi.
Yeah, and not only for emergency services, but you can see a lot of wearable devices which are used by the gym and other health conscious people to connect the data. And so Wi-Fi is not only for emergency, but it is for also preventive care.
Preventive. So moving away from post issue kind of, I'm not a doctor, so I cannot find out the exact medical terms, but instead of getting into a post-event surgical stuff, getting into preventive healthcare, where even before something wrong happens with him, because now he is connected through these wearable devices and somehow the information is reaching out to my data center, I can then possibly predict that he's probably taking too much stress. He needs to be told that please take these following medications just to avoid any stroke happening to you or things like that. So this is what technology can really do now.
Exactly. What Wi-Fi has done is it has allowed us to collect the data which was impossible to collect previously. So whatever, going by the previous concept, like whatever garbage in, garbage out, so the more data you have collected, the more analytics, the more preventive you can do. So even the customer experience, I think Suresh will be able to share, as simple as a feedback form. When a customer walks in, initially a form was given to him where he had to write and give it back.
So initially, what used to do that, we all used to call the patient to go to the particular desktop and you have to do that. Now because of the Wi-Fi, the tab will move around that, we are giving that, give your feedback. Based on that, next time that, he's getting that, what, improvement has been done, whatever may be done, we are able to quickly, complete the things.
So now for, I think the healthcare industry is the most beneficiary of this Wi-Fi, and because it is ultimately becoming a lifesaver, because information being transmitted at the right time, at real time, is a very big boon to the patients who are critically ill. So I think we have covered most of the points, and we are open for questions, unless
One inspiring video which I saw is obviously the idea advertisement, where we could actually see a doctor consulting a rural patient using a mobile phone. Now these kinds of scenarios are becoming possible because of Wi-Fi, and therefore rural healthcare, something which everybody used to talk about being a agenda, a very key important agenda, is becoming a reality in India. That's what I feel.
I think Ian wants to add something.
Yeah, I'll just add one further point, I guess, that, we've talked a lot about connecting people and patients and so forth using Wi-Fi. But one of the major things, especially in the medical sense in hospitals, is keeping track of things, right? So, high-tech medical equipment, you'd be surprised how easily it can get misplaced, obviously using the EcoHealth tagging, for example, and the Wi-Fi systems, being able to locate that equipment in a timely manner can be the difference between someone surviving and dying. So that's a very important point to add.
So one last question to Girish. As a startup, what do you see as a startup? What is there in store for a startup for this industry? Like, where do you see this going?
So for a startup like ours, where we are basically trying to integrate all the essential components of healthcare service being provided, including how a person is moving away from being a patient to being a health conscious or a health aware customer, and that ecosystem essentially is something which becomes very, very fluid, very, very dynamic in nature. Service providers are competing with each other. So I'm sure if you are Mumbaikars, there is a hospital almost every 100, 200, 300 meters. In such a scenario, you reaching out to the customer before somebody else reaches out to the customer has somehow got into the way in which the services are being provided. And that's where, for a startup like ours, we are seeing that to start off with, it is how the hospitals and the patients or the health-aware customers are able to connect with each other, and then subsequently moving on to how we can actually enter into the health consciousness of every individual customer, every individual possible patient in future, because I'm sure every one of us is a possible patient in the future with some or the other health ailment coming into the picture. So how